All right, so welcome to our first video for this unit on abnormal psychology. This is probably the unit that most of you guys have been looking forward to the most. So this video is simply an introduction to abnormal psychology. We're going to be looking at the criteria and how something is actually defined as a psychological disorder, what classifies it, and then in class we'll get into those specific categories and looking more in depth at those disorders. But today is just an introduction. All right, so take good notes. So, abnormal psychology. To define a psychological disorder, right? Mental health workers have to see, first of all, is it a persistent, harmful thoughts, feelings, or actions? Then they would call it a psychological disorder. Now, that means a behavior is probably deviant, distressful, dysfunctional, and dangerous. All right, so if it meets those 4 Ds, you're going to have to know those 4 Ds, that's why they're bolded in red, psychiatrists and psychologists are going to label it as a disorder. All right, so the 4 Ds, now if you just have deviant, so something that goes against the norm of a behavior, doesn't necessarily mean that you have a psychological disorder. You kind of got to meet all 4 of these. So deviant, goes against the norms. Now this will be different in different cultures because what's normal in our culture may not be normal in someone else's culture and vice versa, so you do have to take that into account. All right, so let's say they have a deviant behavior. Now, is it distressful? Does it cause the person or others any type of distress or discomfort and really disturbs them? All right, now if it does that, then let's see, is there a dysfunction? So does it cause dysfunction in that life, meaning does it alter their daily life and they can't function properly? And is it dangerous? Does it potentially or actually cause them to harm themselves or others? So the 4 Ds have to line up, as well as 1 U, unjustifiable. There's absolutely no reason for it that you can possibly think of. Now, odds are it's going to be classified as a psychological disorder. All right, to understand psychological disorders, we do have to understand a little bit of the history behind it, and we will get more into this as well as the 4 Ds in class, like really in depth. I just want you to know the basics. Ancient treatment for psychological disorders way back in the day included trephination, exorcism, being caged like animals, beaten, burned, castrated, mutilated, and even transfused with animal blood to try and rid these like demonic possessions. They didn't really know it had to do with the brain, just that there was a demon kind of in your head somewhere. And this trephination, that little picture here, all right, this is what they would do. They would drill a hole into your head to release the evil spirits. Now, you can probably tell that that definitely didn't help. It probably made it worse or killed you. All right. Then, as time goes on, we start to view it from a medical perspective. Philippe Pinel was the first guy from France who insisted that madness, all right, was not due to demonic spirits, but it was actually a physical ailment of the mind. All right, so keep him in mind. Then we have the different perspectives on abnormality. So we're going to go into the 4 Ds more in depth. We're going to go into the history of psychology and treatment for those disorders. And so this should just basically be an overview of the perspectives of abnormality. So we know that the psychoanalytics, those are Freud, people like that. Disorders are stemming from unresolved childhood conflicts. And in order to diagnose them, we have to look back at your childhood. So that's one way of looking at it. Another way of looking at it is from the behavioral perspective, saying that these behaviors are learned. You learned this abnormal behavior, and we have to look at what reinforces that behavior and why is it still occurring. Cognitive, all right, thoughts and beliefs are the root of our psychological problems, right? And that the only way to fix it is to actually change our thoughts and beliefs. Right, so we have to take a look at that, and we'll look at cognitive when we look at the therapy and treatment part of this unit. Humanistic, those are the people that say that people are responsible for their own behavior, and they say that disordered people don't have any self-worth, or they put a lot of conditions of self-worth on them, and that it's causing a dysfunction because it's just too much for them to handle. Sociocultural say that you're like even not just your personality, but psychological abnormalities and dysfunctions, disorders, may be shaped by family, society, and culture. Are the relationships that you have toxic and causing a disorder? Now, I don't necessarily mean romantic relationships, but I mean family, peers, like community. Are those toxic for you and actually creating a disorder, as well as stress? All right, now let's go back to talking about this medical model. So when we started looking at it from a medical perspective rather than demonic possession, first of all, we had to come up with etiology, which is a causation and development of the disorder. All right, so what is the cause of it? Then once we've pegged that down, we have to come up with a diagnosis. We have to identify symptoms and distinguish one disease from another. You're not just, oh, you have an abnormality in your brain. Well, which particular one? Is it bipolar? Is it schizophrenia? Is it OCD? Is it anxiety? Like, we're going to look at a bunch of stuff. So you actually have to diagnose it and put it in a specific category. Which specific thing do you have? Treatment. All right. Treating the disorder in a psychiatric hospital or outpatient procedures or medication. How do we now have to treat it? All right. We looked at the cause of it. We've diagnosed it. All right. We're treating it. And finally, prognosis, which is the forecast for the disorder. It's your future of living with the disorder. All right. Or how are you going to live with this now that it's being treated? All right. Then there's basically, the big thing behind this that you're going to need to know is this biopsychosocial perspective. We've pretty much talked about this in every unit, how there are biological, psychological, and sociological, sociocultural influences that go into creating something. They're all underlying causes. Same for psychological disorders. So there are biological influences. Evolution, your genes, brain structure, and chemistry. Abnormalities there factor in towards a psychological disorder. Same with any psychological things, stress, traumas, learned helplessness, things like that can bring that out. And sociocultural influences, so your roles and expectations, as well as what is defined as being normal in our society and what's defined as being abnormal in our society. So all three of these factors come together for us to be able to create and classify psychological disorders. Speaking of classifying psychological disorders, there's a book, your textbook talks about the DSM-4. We now use the DSM-5. The American Psychiatric Association came up with this diagnostic and statistical manual for mental disorders. So how each disorder is actually classified within this book. You can Google it for any disorder that you want, and it's all there. There are 5 axes of diagnosis. So the DSM suggests describing someone not just with a label, but with 5 parts of a picture that go into diagnosing you. So axis 1, they're going to look at, is a clinical syndrome present? Is it actually something that can be defined and diagnosed? So using specifically defined criteria, clinicians may select none or one or many syndromes in there that you're having. Next, axis 2. Is it a personality disorder or a mental retardation? So an intellectual or developmental disorder. Is that present as well? Now, it may or may not be. You may meet stuff in axis 1 and not in axis 2, or you don't meet anything in axis 1 and you meet things in axis 2. So just because they don't find something in one axis doesn't mean they're not going to continue. Likewise, if once they find something, let's say in axis 1, they still have to go through all of these, all right, because you can be misdiagnosed if you do that, so you have to go through all of them. Axis 3, is it a general medical condition that's contributing something? For example, diabetes, arthritis, hypertension, are those things also present? Because those types of things also take like huge toll, like a toll on you mentally. So is that contributing? Does that like give us an idea into your life as to why you're acting or thinking the way you are? And maybe it's not just for no reason, it's you're having trouble dealing with something, like one of these conditions. Axis 4, are psychosocial or environmental problems such as school or housing issues also present? Again, it gives us another inside look into what's actually going on to give us a better idea of where we should put your diagnosis. And finally, axis 5 is they have created this global assessment scale of a person for functioning. We're going to look at that in a second, where clinicians assign you a code from 1 to 100 on how well you're able to function within society. So like 100, I believe, is being like the best, like you're highly functional. It's not really a problem. 0 is you are a complete danger to yourself and others. This needs to be treated immediately. You're in trouble. So just to give you an idea, so Table 1, Chapter of Contents in the DSM-5, these go under Axis 1. These are actually clinical syndromes. All right, and we're going to go through a lot of these in class. All right, so like schizophrenia is a whole category, bipolar and depressive disorders, anxiety disorders, obsessive compulsive, stress-related disorders, dissociative disorders. That one's always a fun one. Somatic, eating disorders, sexual dysfunction, gender, dysmorphia, personality disorders. That's a real fun one we'll get into. So all of these are disorders. I'm not going to get into all of them, but a lot of the big ones here we are going to actually look at in class, and they are coming straight from the DSM-5. We're going to look at the criteria and look at cases and say, looking at this criteria and looking at this video or whatever that we have, this scenario, do they meet the criteria for this? Do we need to move on? All right. And finally, to give you an example of Axis 5, all right, that global assessment of functioning, here is the codes for what they actually use in the manual. So like 91 to 100, a person has no problem and are able to function normally within society, goes through various different levels. Finally, down to anywhere between 1 and 10, they are persistent danger to harming themselves or others, right? And many different ranges in between. The goals of the DSM-5 and why we have it is, one, first and foremost, to describe and define different disorders. We need to know this in order to treat people. Finally, to indicate the prevalence of the disorder. How common is it within our society today? And also to keep psychologists on the same page with their diagnosis. So that way you try to eliminate misdiagnosis from one psychologist to the next. One doctor may say you have this, another may say you have that, another may say you don't have anything. Well, if they're all using the same manual, then they should all come out with the same diagnoses. Others, though, criticize the use of this DSM. They say it puts any kind of behavior possible into some type of compass of psychiatry, meaning you could say, oh, I'm feeling anxious today, and great, you've identified a feeling. Just because you're feeling anxious doesn't necessarily mean you have an anxiety disorder, but now we're looking at it under that lens. All right, and then if you get diagnosed, what you do is you wind up treating a category and labeling and a label rather than the actual person themselves. So they're worried about this label, and once it's attached to you, you're treating that label, not the person. So that's a criticism with the DSM-5. All right, so labeling psychological disorders, like I said, critics argue that labels, once you get it, it can stigmatize you. All right, Rosehan's experiment, we're going to look at this in class as well as some other examples for like the Changeling. I'll show you a clip from this movie, where basically it's the impact of a label on someone in psychiatric hospitals. Like when you get into a psychiatric hospital, in this experiment, they were like faking it, saying, oh, I have this, I'm hearing the word thud in my head over and over again, and they basically go through the criteria and they're like, oh my God, you have this disorder, and they admit them into the hospital. And then when they're like, I was just kidding, it's all gone, they're like, oh, well, that's a side effect of your diagnosis, and you're feeling this because, and they can't shake that stigma. All right, they've now been labeled and they can't get out of it. So we'll look at that more in depth with that experiment and some movies that kind of reference it in a way. The insanity label, a lot of people are going to bring this up, but insanity is actually, it is a legal term. It is not a medical term. And this is something that we're seeing a lot more in our society today, politically and everything. It's on the rise. So to raise, this is what's coming up, raise moral and ethical questions about how society should treat people who have disorders, who have committed crimes. All right. You all may have varying different opinions on how to handle this insanity defense or insanity label, but just so you know, insanity is not a clinical term, it is a legal term. All right, we'll talk more about that in class. All right. I'm not going to get too much into it now because we can have a whole like 30-minute video just on that. However, labels are not all bad. They can be helpful for healthcare professionals in communicating with one another to establish therapies. Like, oh, I see you've dealt with this in the past. It helps me to make my diagnosis in the future and helps me in treating you because I already know something else is going on. So it is good to have them in a way. I think it just depends on the situation. However, keep in mind that within this unit, all right, you all are probably going to be like self-diagnosing yourselves or people you know. It's just natural for us to try and do that. But keep in mind, to be considered to actually have a psychological disorder, many factors have to be established and met. All right, so you can be weird or know someone who's weird. It does not mean they have a psychological disorder. Again, you have to go back to those 4 Ds and the U. All right, so just because you or someone may act abnormally from time to time, it does not mean that you or them have a disorder. So keep that in mind as we go throughout this unit, and also try to remain sensitive to this topic that we're going to talk about, because you or others in class or myself may know people that actually have these psychological disorders, and we do have to be careful as to how we say certain things and make sure that it doesn't come off in a negative way, because it's not. It is a psychological disorder that real people are suffering from, and we need to just be sensitive about stuff in this unit when we say give something the label of being crazy or mentally ill, things like that. So just throughout this unit, just keep that in mind, to look at this from a psychological perspective and not put our own personal judgments in on it. All right. Rates of psychological disorders. All right. So the percentage of Americans who actually have experienced selected psychological disorders in the prior year. This chart I found is from 2002. It's the best one I could find. Alcohol abuse, oddly enough, is not an actual psychological disorder, but it's on here anyway. So 5.2% of Americans suffer from this. Generalized anxiety, about 4%. Phobias is a big one we'll talk about, 7.8%. Obsessive compulsive disorder, about 2.1. So you could see the most prominent disorders within America by percentage. All right. And then the prevalence of psychological disorders during the previous year. This is from 2004, comparing us to other countries. So the United States here, all right, any mental disorder at all right, and then serious mental disorder. All right. And you see, we are definitely at the top end of all that. Now, that may be because we have more mentally ill people here in America because our society promotes or condones it or whatever, or is it because we are better at diagnosing it and these countries have lower rates of mental disorders or serious mental disorders because their rating scale and treatment isn't as good? There are people that have gone undiagnosed. They may have more, we don't know, but ours is so good that we know about it. All right, so just things to keep in mind as we move through this unit. Like I said, we are going to, this was just an introduction to give you some baby steps into this unit. And in class, we'll be talking about all of this stuff. And then we're going to move on into anxiety, obsessive compulsive, and post-traumatic stress disorders. All right, so hopefully you got some good notes, and I'll see you back in school.